Hello, everybody. A very warm welcome again on today's lecture, where we will be discussing about the management of first stage of labor. As we know, first stage of labor is defined as the time period that starts from true onset of labor till full dilatation of the cervix, that is 10 centimeter. The duration of first stage of labor varies from 8 hours to over 18 hours. In primary-gravid mother, the duration is about 12 hours, whereas in multi-gravid mother, it is about 6 hours. Here you can see we have divided the management of first stage of labor into two different components. One, you can see it over here, the assessment and evaluation of the labor, and the second, the specific care and attention that the mothers need during this stage of labor. Now let's see the detail about each steps, where we have further divided the assessment phase into different further component, and those includes rapid assessment, assessment of labor, evaluating the condition of mother, evaluating the condition of fetus, and assessment of progress of labor. So now we will be discussing about each one of them in detail. One important thing that we should not forget in the management of first stage of labor is plotting the information or recording all the information related with the progress of labor, related with the maternal condition, related with fetal condition, and with the assessment of labor in a chart that is called partograph. And we will be collecting all the information. We will be talking about the indication, how we'll be plotting the things in the partograph. All detailed information we'll be talking in other session, where we will be having a complete session on partograph. So now let's talk about rapid assessment. In rapid assessment, first we will be asking the mother about if she has had any danger sign related with her pregnancy. For example, if she have any history of vaginal bleeding, whether she had any problem related to her breathing, related to her swollen leg or pain in leg, in any difficulty breathing, or any different conditions she might have encountered, we need to collect all those signs. Similarly, we need to do an initial examination of the mother, where we have to collect the information of ABC, airway, breathing, circulation. We have to get the information or the history of her vaginal examination. We have to check whether she is having any vaginal bleeding or not. We have to check the level of consciousness of the mother. We have to monitor her vital sign, including any abdominal pain she has recent. Similarly, we need to assess the fetal condition, where we will be monitoring the fetal heart rate during the time of relaxation for 1 full minute with the help of fetoscope, as well as we can monitor the fetal heart rate with the help of Doppler. If we find any abnormalities in fetal heart rate, that means the range of normal fetal heart rate should be in between 100 to 160 beat per minute. If we find any deviation in between this normal range, then we should suspect about fetal distress, and we should take an appropriate action as early as possible to prevent from any further complication. In rapid assessment, the other point what we have to do is like we have to collect the history of the mother. Like we have to take the history when she had started her uterine contraction, if she had ruptured history of membrane or not. We have to collect this information. Similarly, if it is possible, we need to collect the information regarding expected date of delivery from the mother. We need to determine the gestational age with the expected date of delivery that we have asked from the mother. And also we need to record, we need to check the information related with her past obstetric. We need to get history of any medical or surgical procedure. We need to collect if she had undergone through any abdominal or pelvic surgeries or any cesarean section before. Similarly, we need to collect information related to any problem with her current pregnancy, whether she had any history of hypertension, whether she had any treatment related with STIs, or she had undergone through any hospital admission related with her anemia or any condition. We need to collect all the information. Similarly, we need to ask the mother about her vaccination, TT vaccination status, whether she had received 2 TT vaccination or not. Now let's talk about assessment of labor. Assessment of labor we can do with 2 different procedures. One with the help of abdominal examination and second with the help of pervaginal examination. In abdominal examination, we need to check woman's abdomen for any scar, whether she had gone through previous cesarean section or not. We have to check in abdomen of mother. Similarly, we need to assess the fundal height. In fundal height, during the time of 36 weeks of gestation, that means the fundal height at the term pregnancy will be palpable at zyposternum. You can see it over here. It can be palpable at zyposternum. But at 40 weeks of gestation, the fundal height will be reduced due to the descent of the fetal head. Similarly, in abdominal examination, we need to assess the fetal lie position and presentation with the help of Leopold maneuver that we learned on our previous lecture. We also need to assess the descent of fetal head with 5/5 palpable. That means when we place our hand on the symphysis pubic of the mother, we will feel the presenting part of the head over there. And this will give us an idea that the portion of fetal head is still above the symphysis pubic and certain portion is already been descend. In the same way, in abdominal examination, we also need to examine the number of uterine contraction that occur in 10-minute period of time, and also we need to evaluate the duration of second that were there in 10 minutes. And about uterine contraction, if it is in latent phase, we need to record that every once in 1 hour, whereas in active phase, we need to monitor that every half hourly. Now let's see what are the assessment of labor we need to do during the pervaginal examination. In pervaginal examination, one important procedure that we have to do is we have to assess the cervical dilatation and effacement of the cervix. In first stage of labor, it should be 10 centimeter dilatation and the effacement should be 100%. We also need to notify the status of membrane bag of water while doing pervaginal examination. We have to feel that whether it is present or not. If the membrane has ruptured during the time of pervaginal examination, we need to notify the color of draining amniotic fluid, whether there is presence of thick meconium stain or if there is presence of white blood, there is presence of bloody discharge. We need to notify that, because if there is presence of thick meconium stain, that indicates the need of very close monitoring, because it might be the indication of fetal distress where we need an appropriate and immediate intervention. Similarly, while doing pervaginal examination, there might be the presence of foul smelling that will indicate certain infection which need again an immediate intervention. We also need to assess the presenting part in relation to ischial spine of maternal pelvic while doing pervaginal examination. It is said to be zero station when the presenting part is at the level of ischial spine. The station is said to be negative when it is above ischial spine, and it is said to be positive when it is below the ischial spine. We also need to check the presenting part through pervaginal examination. The presenting part might be vertex, it might be face, brow, or buttocks after the rupture of membrane. We need to perform pervaginal examination every 4 hourly. We have to perform once every 4 hourly, whereas if there is any indication, for example, like unsatisfactory uterine contraction, there might be fetal distress, then we can do pervaginal examination more frequently, but in a regular routine, once every 4 hourly, we have to perform pervaginal examination. We can see in this picture here of gradually increase in cervical dilatation and the effacement of the cervix, and it has to be 10 centimeter dilatation of the cervix for fully dilatation. During pervaginal examination, if cervix is not dilated on first examination, we have to perform the pervaginal examination after 4 hours. If we find the contraction is increasing, if the intensity of the contraction is increasing, we have to perform the pervaginal examination again after 4 hours to check whether where we can find any changes in cervical dilatation or the effacement. And at that stage, if there is changes in effacement and dilatation, then we can consider the woman is in true labor. If not, if we do not find any changes, then we can consider or we can diagnose it as a false labor. Now let's see the assessment of maternal condition. What are the things we have to look on maternal condition? We need to check maternal mood and behavior at least once every hour. We know the mood of mother keep changing very frequently during the time of pregnancy, during the time of labor. So as per the definition of health given by WHO, mental health has an equal importance in well-being. So we cannot ignore the mental status, we cannot ignore the maternal mood and behavior. In the same time, we need to check the vitals every 4 hourly and more frequently in active phase of labor. Similarly, we have to evaluate the mother condition for any sign of distress. If we find the woman's pulse is increasing, that might be the cause of dehydration, or it might be due to severe pain that she is not tolerating. So we should ensure about adequate hydration through oral, like if the mother is in condition to intake oral hydration, like oral fluid, then we have to encourage her to take fluid as much as possible. If not, we can provide it through IV routes. And if the pain is intolerable, we can provide adequate analgesia also. If we find woman's blood pressure is decreased, which might be due to hemorrhage or it might be due to any other reason, we need to identify the cause first and then we need to manage accordingly. Similarly, if we find acetone in the mother's urine, that will be the result of poor nutrition. In that condition, we have to provide dextrose through IV line. Now let's see what is the assessment of fetal condition we have to do. How we have to do the assessment of fetal condition. During assessment of fetal condition, we need to monitor the well-being of fetus by observing the color of amniotic fluid, where if we find fresh thick meconium stain and heavy bleeding are present in the amniotic color, that will indicate the fetal distress. We need to monitor, we need to auscult the fetal heart rate using the fetoscope, or we can auscult the fetal heart rate using Doppler. And if we find the fetal heart rate in between 100 to 106 beat per minute, we consider it as a normal. And if we find any deviation from that range, that will indicate the fetal distress. We need to monitor the fetal heart rate every 1 hour in latent phase, whereas in active phase, we need to monitor it every half hour. And in some specific condition, like if we find mucinum stent during PV examination, if we found abnormal fetal heart rate, if we are not able to auscult the fetal heart rate with the help of Doppler or with the help of fetoscope, if we find any abnormal condition of mother, then we can continue examine the fetal heart rate with the help of external fetal monitoring device, which is called CTG. Similarly, we can check the fetal condition with the help of fetal scalp blood sampling, where we will be checking the oxygen, carbon dioxide, and pH value that will determine the condition of the fetus. These are the different devices that are used to monitor the fetal heart rate. This is fetoscope. This is a CTG machine which is placed at the abdomen of the mother, and that will monitor the fetal condition. And this is a Doppler. Now let's see how we will be evaluating the progress of the labor. Once it is diagnosed that it is true labor pain, we need to measure the changes in cervix, changes in cervical effacement, and changes in cervical dilatation in latent phase of labor. Whereas in active phase, we have to measure the rate of cervical dilatation, 1.2 centimeter per hour for primary-gravid mother, and in multi-gravid mother, the dilatation of cervix should be in rate of 1.5 centimeter per hour. In the same way, we need to monitor the fetal descent also with the PV examination. We can diagnose unsatisfactory progress of labor if we find irregular and infrequent uterine contraction after latent phase of labor, or if we find the rate of cervical dilatation is slower than 1 centimeter per hour during active phase of labor, we will be considering this condition as an unsatisfactory progress of labor. Similarly, during pervaginal examination, if we find the cervix is poorly aligned to the presenting part, that is also an indication of unsatisfactory progress of labor, which will lead towards the prolonged labor. And this prolonged labor will lead to fetal distress as well as maternal distress. Now let's look at the care that we need to provide to the mother during the first stage of labor. We should encourage the mother, and there should be a proper support to the mother from her near and close one throughout the labor and throughout the childbirth. For example, the close people of the mother should be rubbing her back, they must be helping her moving around, they should be talking to them, and they should be explaining the procedure as per their understanding. Similarly, we should provide a good environment for the mother, where we should ensure about good communication and friendly behavior by healthcare provider. We should explain all the procedure that are understandable to the patient, to the mother, when she should like push during the time of contraction, when she should relax. We need to inform her. We should also tell the condition of the mother. Now we should tell the condition of the fetus. Every detailed information we need to explain to the mother to ensure like she is having well-known environment, well-known procedure during the time of delivery. We also should make sure about the privacy and confidentiality during the time of procedure. We need to maintain cleanliness of the woman and her environment. We should keep washing the vulva and perineal area during the procedure, before and after the procedure. We should wash our hand before and after the examination. And if it is in Latin phase, we need to encourage the mother to do ambulation. But in active phase, she need to take rest. We also need to encourage the woman to empty her bladder regularly, but we should not make it routine for catheterization because it is prone to infection. We also need to encourage the mother to eat or drink in latent phase, and in active phase, we need to encourage the mother to have a liquid diet more frequent. If it is not possible to drink during latent phase, we need to establish the IV line, and we can also establish the IV line if the labor is prolonged or if it is leading towards certain complication. We need to teach the mother about breathing technique, like when she should breathe, when she should relax, and in between different breathing pattern, like when she should put her force, and in during relaxation when she should take relax. If the mother is in distress, like if she is in very deep pain, we can ask her to change her position. We can encourage the mother to come to go for some ambulation, which will help in reducing her pain. We need to encourage the mother, like we can encourage the mother's companion to massage her back and to support her during the time of distress by pain. Similarly, we need to encourage the mother to use the breathing technique. And if still the pain is not relieved, we can offer morphine injection 0.1 mg per kg body weight by explaining about the advantages and disadvantages of the injection. And before giving the injection, we need to obtain the consent. We also need to inform the mother about painless delivery procedure. So this was all about the management of first stage of labor. Hope you understood. These are the reference from where I have collected for preparation of this lecture. So this was the end of today's lecture. Please take care and stay safe, everybody. And thank you.